Uh, Professor Pekka, thank you very much for coming to us today to record the podcast. Welcome to Japan.
Thank you.
How was your trip?
It has been good as far.
This was good. Yeah, that's good to hear.
Enjoyed a lot.
So, Professor, in the beginning, I'd like to ask you to introduce yourself in the way that you would like our listeners to hear it from you directly.
So, my name is Pekka Vallittu, and I'm coming from Finland, from city of Turku, working as a professor of biomaterial science and heading dental school at the University of Turku. It's part of Faculty of Medicine, and that is somehow also reflecting what we are doing research-wise. It's very multidisciplinary research we are running in Turku in our field of biomaterials.
I see. I hear you're doing some innovative work with regarding to composite resins.
Yeah, composites, or can I say it, non-metallic biomaterials has been major part of my research since now for more than 30 years. So I started to look at fiber composites, especially from perspective of my hobby. It was model aircrafts in here when I was child. And at that time introduced me to this highly durable nature of composite materials, which actually can be found in nature too. Wood is a very typical fiber reinforced material, and bone and dentin also, and that has started to put us to think more, can these man-made composites, fiber reinforced plastics, be used in dental medicine? And then here we are now, we have a lot of ongoing and also clinically approved materials and technologies.
So what's the concept behind it? What do these fibers do for the composites?
They are, in a first instance, they are toughening the material, meaning that when there is anyhow somewhere minor crack, which may start to grow and finally broken and fracture the whole specimen or material, these tiny or long fibers inside, they are stopping the crack growth. And that is the basic mechanism how fiber composites are working.
So they enforce the composite and
They are
prevent propagation of
yeah. They are enforcing strength, meaning that it's more durable for bending, for instance. But very important is that they are hindering crack growth. Crack is not propagating your material when the crack meets the first fiber and then thousands and thousands of fibers. It's very different that of, for instance, in our dental field, we know ceramics, they are bulky materials and brittle ones.
Yeah.
Also, zirconia is bulky and brittle. So when we have first crack, for instance, in a zirconia bridge, if that crack is loaded, nothing hinders crack growth and final catastrophic failure.
Yeah.
But when we have divided these brittle reinforcement in fiber composites, thousands and thousands of single fibers, crack is trying to find its way when it meets all the time new and new fiber. And that's make the composite so tough, which is very different that of ceramic materials. That's the reason why fibers are used in wings of airplanes. They are bending and bending but not breaking.
I see. So it's the same technology for the.
Yeah. Or tree bending in the high wind. It's bending but not breaking.
Yeah.
Or our bones, when we are running and walking, they are slightly bending but not broken.
But they don't break.
Yeah.
I see. Very interesting. So I'm glad you said like you can find many examples of this actually in nature and in man-made technologies. But for us as a dentist, where can we use these kinds of materials? Like where would it be very applicable?
Basically in all fields.
Yeah.
In today's reality, we are using the fibers in prosthodontics, periodontology, and restorative dentistry. Prosto, it's typical that we can make directly or indirectly fixed partial dentures, which are adhesive bridges typically, and they are luted on surface of tooth. And that is very, very good application for the material because, in fact, this is the first and only material which can be shaped, bonded directly in mouth, which is going to have then finally almost metals mechanical strength. So you can basically make one visit instant bridges, and then those are very, very suitable for children, elderly patients, and all of them who are very busy in their life and don't have time to visit several times, dentists, for instance, and need to have something in a way urgency treatment, not to be without, for instance, one front tooth. So that is where we started. Bridges, partly because of my history as a dental technician. So I look at this from a prosthodontic perspective.
I see.
But thereafter, we have noticed that in root canal posts, they are used. We have a new concept for using fibers in posts. And then also in fillings. Lard, endodontically treated teeth have huge cavities. And then if we put just a regular composite, it's not the best solution. We could, by help of this kind of fiber composite system, we can mimic dentin, which is fiber reinforced material, collagen, hydroxyapatite, and then replace that with man-made fiber composite out of glass and polymer. And then what is left on top of that, which has been enamel, that is then veneered with our regular nice polishable veneering composites. So in a way, structure-wise, from material we are mimicking bone by fiber composite, but as an entity of tooth, enamel plus dentin, we are mimicking this kind of bi-layered structure where we have enamel dentin, filling composite and fiber composite, which is mechanically supporting the rest of the tooth.
I see. So, as a material itself, can it be used by itself alone to make the whole restoration, or like with combination of other materials?
No, as far the recommendation or instruction has been that the fibers are covered with regular composites to have it nice looking and highly polished. But we know from our studies, in vitro and clinical studies as well, that there is a possibility that we are leaving some of the materials, not necessarily all, but some of these fiber materials exposed to the oral cavity. They do not be as shiny necessarily as our best aesthetic composites are, but they are absolutely good enough, and they are not absorbing plaque on the surface like can be expected.
Yes, but because you said fiber, so I'm thinking like maybe some of them will stick out.
No, that is often asked. Are these protruding out and rough, and then are they maybe becoming loose and causing some problems in our digestive system? But no, they are actually highly along to the surface, and they are not protruding out. It's not only fibers; they are also particulates. So it is fully inorganic, organic matrix composite, like whatever our composites are, but part of the components are fibers. So they are not coming out. And it's very smooth on this surface.
Yeah, because I think most of people will think fibers. Okay, well, maybe they will come out, but
it's always asked.
It's always
And that's why we have paid a lot of attention to make research that is it happening in the first case.
So there is obviously a lot of research that shows that this doesn't happen.
And interestingly, wear resistance, which is clinically important properties, all the studies showing that these materials are having actually equal or even better wear resistance than commonly used composites, although there are a couple of these big fibers included on the surface.
I see.
But as said, it's not only fibers and matrix, there are also particulates.
I see. You said like you can use it with any case for like in which composites like are kind of used. Are there any contraindications to use this material? Like some cases that maybe this material would not be fitting the most, or like basically you can just use it in your daily life?
I would say, or it can be used wherever we need big amount of composite resin.
I see.
Because it's understandable if this material is double as tough mechanically and strong as our regular ones, why shouldn't we make the base for any kind of restoration of this? Is it endodontically treated or vital tooth? It doesn't play a role. If there is a lot of loss of dentin, then this should be used as a dentin replacement material.
I see. So basically, we're replacing the dentin
Yeah,
part of
yeah,
the tooth
yeah.
with this material. I see. Thank you very much for sharing all this information with us. Uh, in the end, would you? And it's I know you're. This is a little bit of a shorter interview that we have, but this is because your schedule today is a little bit tight. In the end, would you like to introduce some um specific cases, for example, that you have witnessed the material working perfect for? Like obviously you said like to replace dentin, but in endodontic treatment also. But did you like use this material in a certain case and realize like, oh, this was perfect? Did you have this kind of experience before?
No, as said at the beginning, I started with dentures and fixed partial dentures.
Yeah.
They are perfect for those.
Yeah.
But in those indications, you have to be willing to learn to use the material.
Yeah.
Otherwise, it's not just take a material, put it there, it doesn't necessarily work. You have to be eager to learn how to use it, and then you can get very nice clinical outcome. And most importantly, very happy patients.
Yeah.
They are having replacement of tooth instantly.
Yeah.
But on a bigger scale, when you are looking application where the can I say technique sensitiveness is not that high, they are fillings and endodontically treated tooth. We have seen, for instance, very nicely that when we combine this material for core build-ups with fiber post, custom-made, individually formed or prefabricated posts, which are most commonly used, we can have the entire system from root canal to be reinforced with fibers. And that kind of combination of long fibers in post and short fibers in this core build-up material, even as a cement, would make the restoration and very, very durable by long term.
I'm sorry I said we were wrapping, but I have one more question for you.
Yeah, please.
When you mentioned like being eager to learn and being able to actually work with the material, how easy is the manipulation of this material?
It is easy. We know we have this in our undergraduate program in several universities in Nordic countries for years, or even more than 10 years. And then we see that when students are learning this from the very beginning, they don't have any problems not to use it. But once you have learned this kind of classical way of prosthodontics, that you are simply cutting down denting and taking impression and closing your brains, then you may have problems. So it's material where you have all possibilities to design, engineer in mouth by your own hands. I know so many colleagues who are fully enthusiastic. They cannot live, like myself. Not best. I cannot do dentistry without fibers.
I see. I've also like heard so many people talking about the material, and they were like, it's really is kind of revolutionary, like innovative, quite innovative to kind of use this technology in composites.
Yeah, and finally, it is mimicking nature.
Yes.
And it's non-metallic. Metals, they are good. But for instance, cone beam CT scans, they are causing a lot of artifacts in the images.
Yeah.
And that's why composites which are having optimized radio opacity visible in X-rays, but not too much. It's like tooth or dentin enamel. They are the material choice also from imaging perspective.
I see. Well, okay, then thank you very much for sharing all this information with us today.
Thank you.
I hope you have a very nice visit to Japan, very productive meetings, and hopefully, we'll have more time in the future to discuss a bit more about this very interesting, innovation in dentistry.
Thank you so much.
Thank you very much.